Hello, everyone. Good evening on this beautiful Thursday evening. This is On Deck Black Health with the legendary, the man, the myth, the legend, Daryl Moss and Joe Schmo, Justin Yard,
What's up?
with another captivating show today. We have a subject matter that's near and dear to obviously both of our hearts, but it's focused on women's health, and we have two leaders in that, I would say, that have come highly recommended in their fields. And I'm going to have them introduce themselves. One is a doula, and another one is a midwife, and another one is a doula and midwife in training. So we'll let them introduce themselves. Miss Adrian, I'll allow you to take it on from here and introduce yourself.
Hi there, good evening. It's a great pleasure to be here. Can everybody hear me okay?
Yep, loud and clear.
Okay, so my name is Adrienne, and I've been in maternal child health for almost 30 years now. Started off as a registered nurse in labor and delivery, worked in school nursing for a number of years, and then went back to school for my midwifery degree and master's in nursing education. So I've been doing this now about 14, almost 14 years now. And I enjoy working with women and empowering women to be the best that they could be and to know about themselves. So it's a pleasure to be here.
Thank you. Thank you.
I'm Sayana. Sayana Devotion of Earth's Natural Touch Birth Care and Beyond. I am a doula. I've been a doula since 2001. I'm a certified lactation consultant. I am a midwifery student practicing to serve families in out-of-hospital settings. And Earth's Natural Touch Birth Care and Beyond is an organization that focuses on reducing undesirable pregnancy and birth outcomes that are negative. We also want to improve breastfeeding and lactation because we know that the health trajectory of Black babies depends on that. We also want to just support families overall in anything that they're dealing with, whether that be bereavement, fertility, any area that they may need assistance in.
Thank you very much. And so I want to start off with having both of you define both of the areas that you're in so people can get a better understanding of what you do and how you do it.
Whoever would like to go first.
Whoever wants to go first.
Miss Adrienne,
Okay.
I give her the floor.
Okay. All right. So I work with women from adolescent years all the way up to the postmenopausal years, adolescents to beyond, menopause, providing care in primary care, GYN, family planning, preconception, pregnancy, birth, and in the postpartum period and with newborn up into about the first month of life. So I work with women, again, just to empower them to be the best that they can be so that they can make informed decisions. I enjoy working with women, and that's what midwife means. It means with women. And so we work with women to, again, just to empower them. And I have 4 daughters. And so really allowing them to be able to make informed decisions regarding their care. And then with the disparities of the infant mortality, especially in the city of Springfield, it's very near and dear to my heart, preventing preterm births and increasing nutrition for women as well.
Yeah, so the work that we do is pretty much aligned. As doulas, we work alongside families to help them find their voice, to let them know what their options are from preconception all the way through to postpartum, and providing that real personal support. So we're like your homegirl is going to walk with you through your entire pregnancy and let you know what your options are, let you know what questions to ask in case you don't know. and just give you that ultimate support. We're really trying to eliminate racial and ethnic disparities in birth outcomes, including infant health and maternal health, because like Sister Adrienne just said, the rates are horrendous, and I'm sure Springfield is probably not very different from where I am in Connecticut right now. And actually, we're not as bad as some of the other states are. So that doesn't mean that we don't have work to do, though, because one baby or one mother is one too many, right? So we're out here trying to just make a difference and to get people to even understand the value of the support and why it's necessary. And we also provide some education to healthcare providers as well, so that they can understand the social determinants, some of the historical factors that go into the situations that we're in now, because it's not just, we say that race is not the risk factor, but racism is, right? So that's like infused into the system that is affecting the birth outcomes. And sometimes you need somebody to point those things out to you, especially if you're going to be in a position of caring for the individuals that are dealing with the worst outcomes.
Thank you so much. That's beautiful. That's beautiful. That information is very important for people to understand what you both do. And Miss Adrienne, I know that specifically you're working in the hospital, getting women while they're about to give birth, which is a very, very, very sensitive time for them. And if you can give a little bit more knowledge on kind of the process and what you've seen throughout your process and your time and your history of being in your field, can you give us kind of a rundown when somebody first comes into the hospital and they're ready to give birth?
Absolutely. So I work in a practice where we are, midwife friendly area. There are lots of hospitals that are out here that are not midwife friendly. And so as a midwife, we really work with women and try to help them to know that, less intervention can be, healthy for them and for their babies, allowing them to know that they do have decisions. They do have, the right to ask questions and have a birth plan as to how they want their birth experience to be. So educating them, when they first get there about the practice and about their health and how often we want to see them and how we want their pregnancies to be healthy. So that's where we start. And then we continue to follow them throughout the pregnancy. And lactation is a huge part of our education as well, because our moms breastfeed, because we know that breast milk is best for the baby, and getting those first drops of colostrum in for all the protein and antibodies that babies will need. And so getting them established with a peer support through a breastfeeding peer support program helps them to establish breastfeeding and hopefully keep them breastfeeding for at least a year or longer, is what our goal is. And so when it's time for them to have their baby, a midwife is with them one-on-one. Sometimes we can't be in there the whole time. We have more than one person having a baby at a time, and that's where a lot of our doulas will come in, because working alongside doulas, they're able to be in there and provide that because they're with that patient, and they've established that connection with them to be with them throughout the entire piece. So, but allowing them to get up and move freely in labor, hydrotherapy, and helping them with pain as their labor continues to progress. And so just being there for them is what our goal is.
Thank you. Unmute yourself.
Unmute. I'm sorry. I was reading an article a while back. Hold on. Ms. Adrienne, I think that's yours with the feedback. I'm going to put you on mute for a second. Okay. I was reading an article a while back on doulas and the city of Baltimore back in about 2017 and how they turned to doulas to give Black babies a better chance of survival and more support for Black mothers after giving childbirth. Now, Baltimore did this officially. Do you know of any other cities that have done that? We know the story of who's the tennis player?
Serena.
Serena. We know her situation after giving childbirth. Tell me why this is so critical. I think you're on with two males. So
Yep.
I'm learning more and more about this every day. And I think a lot of brothers need to be up on this and need to learn as much as they can. So you got to school me like I'm a fifth grader.
Well, I appreciate you being on, because it's better that you're here now than to have experienced a loss and then trying to figure out how to do this parenting thing by yourself.
Okay, you're absolutely right. So let me ask you a question. Have any other cities turned to doulas, look to doulas and say, listen, we need this extra support system from a systemic perspective? Can you talk about that?
Yeah, so not only cities, you have several cities across the country, but you also have states. So some states have actually made doula support reimbursable by Medicaid, and they've infused that into their systems. There are some issues with it. It's not as easy as it sounds. And the doulas are not totally happy with what happened, but they are trying. And you do have some states that are looking to try to implement something similar where doulas can be reimbursed and the families would not have to pay. Because this is an equity issue, right? So we know that, for example, where I am now, 60% of the population is on Medicaid. Right. So those are families that are not going to be able to afford the doula services, but those are also the families who are experiencing the worst outcomes.
Absolutely.
So those are the families who need the support. So you do have local organizations who are working to try to get politicians to understand the importance. And it seems like the politicians are listening. Up until COVID, we had made some really big progress. And I don't know how things are going to change now with the pandemic. In the meantime, you have local organizations who have stepped in and tried to implement different programs in order to make sure that those families are still getting the doula support that they need. So you might find organizations like Hlth Start. They have over 100, I think 101 sites across the country. One in Connecticut has a doula program, one in Pittsburgh, and I'm sure there are others across the country that have implemented doulas into their programs. And then you have doula organizations who are receiving grants from larger organizations. Like we received a grant from the March of Dimes. We work closely with the United Way, Bridgeport Prospers, and just trying to make sure that doulas are infused on the ground and reaching the families who need the support, because we can't wait for politicians to decide that this is something that's necessary.
Okay. How responsive, and then I'll talk about the midwives, but while we're on the doulas, how responsive are healthcare professionals when doulas walk into the room, especially doulas of color?
It depends.
Okay, let's be specific. Black doulas.
It kind of depends. It depends on where you are. It depends on the hospital. It could depend on the environment. You have some providers who are really appreciative, like Sister Adrienne just said, these are doulas who are able to stay with the client during the times that medical providers are unable to be there. And we know the value of having doula support, right? There are less interventions, there's higher birth weight, there's less premature births, there's less cesarean sections, less epidural use and Pitocin use, which is a drug to kind of make labor go along, more breastfeeding. So there are medical benefits to having a doula. It's not like we're just holding hands and rubbing backs. We know that the outcomes can be improved. So you do have some medical providers who understand that. And then you have some who are not too happy about a doula being in the space, because the doula is the one who is making sure that the client realizes that they have a voice and communicating questions that they can ask so that they understand their options. And sometimes medical providers don't really want that. They just kind of want things to go the way that they want it to go. And so they may feel like doulas are kind of doing a little bit too much, but the bottom line is that the doula doesn't work for the medical provider, right? They're not hired by the doctor or the midwife. They work for the family, alongside that family. So that's the ultimate goal, to make sure that the family knows what's available. And if the information is not available, let's get it. Let's figure it out.
Okay. And hold on, I got Miss Adrienne. I'm sorry, Miss Adrienne. I didn't want to.
No, you're good. I'm listening. No, I'm agreeing with Sister here.
All right. I didn't know if you want to chime in anywhere or. You're okay. So
No,
what I'm gonna do is I'm gonna let you mute and unmute yourself. So whenever you want to speak, you can jump in. Cool.
okay, jump in. Okay.
All right. So, all right. What I mean, well, there's two-part question. What can we do to really? I mean, since I found out about doula, my daughter was born with the assistance of a doula, and I'm like, oh, this is pretty cool, pretty effective. So, but I mean, as old as I am, I had no idea what a doula was. So, what do we need to do in terms of public relations for those of us who have any sphere of influence? How can we help get this information out there? Because I'd rather have a doula in the room than have a doctor, to be honest with you. Sorry. I just seen how effective the sister was in the room. So what do we need to do to get more information out there to really push this so that it's not just, I don't know, something that a few circles know about? I'm gonna be quiet right now, and then tell me, what can brothers do? Hold on, Jay. What can brothers do to help out in this process as well? What more could we be doing? So, two-part question. I'm gonna be quiet now.
Three part.
Three-part.
Define what a doula is, so there's not too much ambiguity, and then do what you do.
Okay, got you. So let's keep in mind that doulas have always been in existence, right? So doulas are basically support people who are available to the birthing person during their pregnancy, labor and birth, postpartum, right? So you've always had communities, that look like you and I, your mama, your grandmama. And I'm sure that there were things that they did that you probably didn't even realize was part of the traditions that we passed down among each other, right?
Right.
It didn't become a profession until some white people went to indigenous countries and saw the birthing practices of those people and decided to monetize it and make it a profession. So outside of all of that, we've always done this work. Unfortunately, nowadays, we can't do the work for free, right? Because it is tiring, it's draining, it requires a lot. So it has now become a profession. But doulas are the support people. They're not the medical provider. They're not the OBGYN. They're not a replacement for the midwife. The midwife and the OB are the ones who are actually doing all of the medical support, in addition to the nurses who are available for the client. The doula is doing everything else. So the education, the information, the physical support, the logistical support, making sure that things are in place. We have clients now who are struggling with housing. How can we find them some resources? We have clients who are struggling with finding diapers. How can we make sure that they have the things that they need? So you have some doulas who are really trying to do the work on the ground, and it's like I say, it's not about just rubbing backs and holding hands in labor. I know that when people hear about doula, they think Erykah Badu. You might burn an incense here and there, but it gets real. So it's not just all of the fluff. And it's hard work. So what we can do to spread the word is continue to do things like this. I was just speaking at Yale to a bunch of medical students who are soon to be medical providers and sharing with them all of this history about how we got to where we are now so that they can have in their minds the best practices that they can implement when caring for families. So just continuing to invite people to different spaces, continuing to talk to your friends about it, continuing to talk to your children, your daughters, your sons. And I would even say the same way that we think about saving for college is the same way that we need to think about investments in our future, right? Because those are our legacy. Those are our children, our children's children. And so I support the idea of having fertility funds where you put some money aside every month, even if it's $20 into an account, so that when your child or your grandchild is ready to have a child, you have the money so that they can take a childbirth education class, so that they can have lactation support if they need support outside of the hospital for lactation, so that they can have the doula services and even the postpartum support. Because we don't get to do the things that we used to do, right? We used to go into homes, we used to cook for each other, we used to bathe each other, we used to have the food trains going, all of those different things. So we don't get to do that anymore. And then on top of that, we're hit with the current pandemic. So now you have people who are faced with not having the support that they probably really need. And we see it in a lot of families who are dealing with perinatal mood and anxiety disorders because they feel isolated. They don't have family around. They can't have family around. You know, grandma's not able to travel to come, or you can't travel there. So these are some really trying times, but I think that the conversation is picking up and more people are talking about out of hospital support, midwives, doulas, breastfeeding, you know, all of these things that can be put into place to make our outcomes better.
Okay. Thank you. Oh, the part about brothers, what else can we be doing?
When I was saying share with your children, that was for y'all.
Oh,
so this is not a woman's conversation. This is not just for the ladies, right?
No, that's why we're here, because it's like, it's a fair. I mean, I guess the thing we have to change, we have this tendency to compartmentalize our community.
Mm-hmm.
We in the back, we put our women over there, we put our brothers over there, but what we're really talking about is family.
Exactly.
So it's a family process. That's why we're asking these questions. So thank you.
The same conversation. So whether it be in a barbershop or wherever that the brothers are, that conversation about the birth and your experience and how it felt to hold your child for the first time or to experience skin to skin, that can lead to the benefits of skin to skin. That can lead to a discussion about how the doula was able to support you in that. You know, so just having conversations about parenthood or fatherhood can lead to conversations about doulas and the support that we can provide. And I don't know if y'all have those conversations the way we talk about motherhood, but
we some of us, we talk about our kids, but in a different capacity. So let me ask you: are there any male doulas? It sounds retarded to ask that question, but I gotta ask anyway.
It doesn't at all. There are male doulas. There are male doulas across the country and in other countries as well. And we've actually had some people contact us about becoming doulas that are males. And we're working with a state organization, and it's not going to exclude males in the process. If they're interested in participating, then they can. There is, you know, some discussion amongst birth professionals about men being in that birth space because, you know, historically that wasn't something that men did, right? Men didn't even attend births until white men went to Europe and started learning about obstetrics, and then they came back and started attending births.
Are we talking white men, or are we talking everybody?
We're talking white men.
I don't want to be in their boat. Let's talk about us.
Yeah. So what I'm saying is that prior to them coming and creating obstetrics, everything was about midwifery.
Okay.
So men weren't involved until that happened, right? So once that happened, now you have the men that were looked at as the professionals in the field, and the midwives weren't really regarded as much of a professional, right? Wow. So that whole shift happened, and so this is why we have men in the forefront. When you look at other countries that have better outcomes than we do, one of the things that they have in place is midwifery care as the primary care. The midwives don't step in. I mean, the OBGYNs don't step in until that client needs a higher level of care. Then the OBGYN steps in to take care of the client. But prior to that, everything is about midwives. So the discussion amongst the birth professionals is this a space for men? But we have spoken to a lot of women who would appreciate having a male presence with them if they're a single mother, or some of the fathers who want to hear from another father how to support their partner. So there is a space for men in this field. I think that is something that is starting to develop and pick up speed.
All right. And I'm not listening, man. I think it's a beautiful space for women. I don't have a problem with that. But for brothers that, you know, can, I'm the one who's in the birthing process. So I gotta keep it real. So for the brothers who want more space in terms of what we need to do in the room, can we be in the room? That type of stuff is just critical. I'm sorry, Justin. Go ahead. You're muted. Justin?
Yep, I was going to ask Ms. Adrian. So now that COVID is hitting, all right, so now we're dealing with the mothers not having access to their families. What is being done to make sure that they're not being alone during their birthing process? Is there anything else that's being done on the hospitals and to kind of to take that over, Ms. Adrian? Like what's happening?
Unfortunately, with COVID, we are only allowing one person into the birthing room with those with our patients at Mercy. Now, I'm not sure if the Bay State Hospital is actually allowing the doulas to come in at this point, but initially when COVID, came into play, no one was allowed into the room, and we really fought hard because women need to have another presence in the room with them for that support, mentally and physically. So we really fought hard to make sure that at least one support person was there with that mother during that labor process. And as far as, whether it be her mother or whether it be her sister or whether it be her husband or, significant other, the father of the baby, it's really important that they have, support in there for them to get through this process. And Daryl, you were asking what can brothers do in the labor room? Be there. I have some men who just, they don't want to be too close. They feel queasy or anything, but we'll put you to work. Be up at the head, top of the bed, rub her brow, give her some ice chips to eat, those kinds of things. Those are supportive. It may not seem like it's a whole lot, but you don't have to be down there at the bottom, of the bed or anything like that. Just being up there, just being close to her, knowing that you're there for her, that is what is going to help that woman also through labor, and that's what men can do for their lives.
And to confirm, I just got some information from Laconia, my partner, that she's also a doula. As of last week, Bay State allows 2 other people, the significant other and the doula, to be in the room. Bay State has made that move and that change.
So here in Connecticut, it changes almost every day. One day the hospital will allow 2 people, and then the next day they're down to back to 1 person. And I guess they're, changing that based on what's happening with COVID currently. But it's unfortunate because when that person goes home after giving birth, there are no services really that are continuing to follow them until their 6-week appointment for the most part. And we know that postpartum is a time when a lot of mortality happens, and a lot of people are slipping through the cracks and being ignored.
I'm just saying, I'm hearing what you're saying about the hospitals. I know Tinita Council just said basically is allowing 2 support people, but we aren't regarded as part of staff anymore. I think that's a critical point. I see you on the sidelines, Tinita. Politically speaking, for those of us who are involved in the political processes in our respective areas, what could we be doing? Because I think as people talk about what is the new agenda for Black people, given the current election, the new congressional offices and all that other stuff, is this something that we should be putting on that agenda and addressing as we establish medical protocols and legislation around healthcare delivery, that type of stuff? I mean, because it's kind of crazy because they're worried about someone being impacted by COVID and possibly getting sick and it being fatal. But at the same time, we're worrying about black babies and Black women being in a situation that could be potentially fatal. So is there any type of legislative action that we could be taking to really push this agenda?
Absolutely. And I know that there are doulas who are involved in that in Massachusetts right now. I know Ayanna Presley was big on Black maternal health. So I don't know exactly what the details are in your state, but here in Connecticut, we do have a doula coalition and a state-run doula task force that is made up of different organizations. So you find the people who are interested in making sure that this happens. So we have like people from Planned Parenthood, Health Equity Solutions, United Way, March of Dimes, all of these different organizations come together with us, the doulas, and lobbyists as well, to make sure that this is on the agenda and being addressed. And we meet throughout the year. Even though the session is closed, we're continuing to do the work behind the scenes. So I would say definitely reach out to different organizations and see what's going on, and see how everyone can bring it all together. And it may actually be in existence already.
Okay.
Yeah. Yep. So I was getting ready to say, so we do have the Springfield Community-Based Doulas program with Erica. I know she's the one of the co-founders of the doulas here in Springfield. I know she's working hard. I think she may have taken a little hiatus, but but working hard with getting doulas and support and legislative support as well.
Good.
For our doulas and our midwives.
All right. So, Miss Adrian, I'm gonna throw this out to you. I know they already have one like Black periodical. We're starting a community-based newspaper called the Metro Record. And I'm going to ask if you guys have any information you want to convey, get out to the public. That just contact me. We'll put that information in there. Once we're already online, and once we go to print, hold on, let me just speak for a second. Once we go to print, that's information that we would love to have in the newspaper. Anything that they're doing, anything we can do around, assist with in terms of legislation, any Boston contacts that we may have, we'd be more than happy to lend to you. Educating the populace is always a critical piece of any type of movement. And we talk about saving Black women and Black babies, that's definitely movement. So whatever we can do to assist, we want to make that service available. Okay.
Okay, I appreciate it.
Yep. Justin, back to you, man. You're muted, Justin.
Always. So there's always a lot of ground movement going on in Springfield. I know Laconia and Tanita also are working to get doulas into the hospitals. Not only getting doulas into the hospitals, but also creating support systems for the women, because watching her go through her process and being a doula and creating these community organizations and community run, even fundraising opportunities to get support around women postpartum, especially, which seems to be where the highest mortality lies. They're also doing a lot of work in that as well. And I was going to go ask a question, like, a lot of people want to know, because they are planning their pregnancy or they're pregnant at the time, and they want to know kind of what risk factors as Black women are they facing, and their husbands as well, and want to know what risk factors they're facing, and kind of what are the disparities as far as I want to say ailments, diseases. They're already what's the word I'm looking for?
Predisposed.
Yeah.
Ms. Adrian, you want to take it?
I will take it. Yeah. So some of the risk factors that predispose women to these disparities are obesity. African American women are more at risk for your pulmonary embolisms, for hypertensive disorders, and diabetes. So educating women, pre-pregnancy, okay, our preconception counseling, getting healthy, are ways that we can hopefully try to prevent those comorbidities to happen during pregnancy. So I think that is a major thing that we need to do in our community is healthier eating and exercising as well, so that you're in a healthy state prior to getting pregnant. So that's what, part of our goal is as well, in the office is to help that to happen. Other things that women are at risk for in the postpartum period are your perinatal mood disorders, as well as postpartum hemorrhage. We know that women our African American women are at higher risk for having postpartum hemorrhage and dying from these things in the birth process. So educating and coming up with a standardized plan of care to help prevent this from happening is going to be beneficial as well.
I would say we definitely encourage people to start planning, a year ahead, to make sure that their bodies are in good health prior to conceiving. Every now and then we get that slip up. That's usually what happens, right? And it's like, oh shoot, I'm pregnant. We didn't plan for this. We didn't prepare. So we're really trying to change the idea about preparing ahead of time. And also, Sister Adrian mentioned, diabetes and hypertension and things like that, but even things like asthma, if we can try to get that under control, that can help. We have some clients who have heart conditions. Unfortunately, there's not much that we can do about that, but if we plan ahead of time, we can make sure that they're in the right care. And even postpartum, she mentioned the postpartum hemorrhage. Postpartum preeclampsia is a big deal with our clients lately. We've had 2 clients in the last 2 weeks or so who have been diagnosed with preeclampsia postpartum. And I think a lot of people don't realize that that can happen postpartum. It's usually talked about in association with pregnancy, but it happens. And so just knowing the warning signs and what to look out for. And we find that a lot of times the birthing person doesn't really want to speak up. They're afraid to speak up and speak out, and so they need, because sometimes you start to question yourself, is this really happening? Oh, it's not a big deal. As Black women, we sweep it under the rug and keep moving, right? Because the dishes got to get washed, or now we have a new baby to take care of. But sometimes having somebody else who's aware of those warning signs can really propel you to get the help that you need. And fortunately, we had two doulas who were in a position to encourage their clients to go and seek medical care. And one of them started having heart pains while waiting for care in the hospital. They left her for 4 hours in a hallway in a gown on a push cart kind of thingy, with the heart pains and swelling, which are associated with postpartum preeclampsia, which could have easily led to eclampsia, and she could have started seizing and even lost her life. So
pulmonary embolism, so that's just
exactly
not acceptable.
Yep, pulmonary embolisms, cardiomyopathy, all of these different issues can come up. And sometimes pregnant women are just not aware of what to look out for. And this is where the partners can step in at again. If you've taken a childbirth education class ahead of time, you'll kind of be aware of what's normal and what's not normal. And if you don't remember, you can always go back to your notes and say, I don't think your feet are supposed to be swollen like that 7 days after you've had this baby, right? Even if she's like, oh, it's just okay, I just been working kind of hard, you're like, no, I think you need to go in. So it takes an effort from everybody to make sure that our women and babies are safe. And it's just really hard right now.
Wow. Okay.
Just to comment on that, making sure that your partners are aware, even with the perinatal mood disorders, for sure, making sure, that the woman is taking care of herself, taking care of her baby, and the partner being aware of some of those signs that they need to look for. If she's not, bonding with that baby, doesn't want to have anything to do with that baby, they need to make the calls. There are services in place, MCPAP services for pregnant and postpartum women, which is a psychiatric service and therapeutic service for women in the postpartum period to help with those perinatal mood disorders and get them connected with behavioral health services, because it is on the rise, and we definitely need more legislative around that as well.
Which brings up another point, is that when we're asking for legislators to step in for doula support, we're not just talking about birth doula support. We're talking about postpartum doula support. We're talking about bereavement, because you also have families whose babies don't make it, who are experiencing stillbirths, or they bring their babies home and they're dying in less than 27 days or less than a year, which is considered infant mortality. So, what happens to those families? What happens to them emotionally? And there needs to be some type of supports in place.
Yeah, I agree with that. Just?
Yeah, I think it's very important for people to understand kind of what happens after birth. I mean, especially when a woman comes home and doesn't have support during these times, is very important. And if you guys know of anything that people can do, especially now we're under restrictions from the government sanctions that are going to limit the access to somebody that just gave birth. What are some things people can do to help and assist somebody that's given birth postpartum, and to kind of help them along the way, since they can't be there physically as much?
Mm-hmm. You want to go, Sister Adrienne?
Sure, I will. Okay. And some of the things that folks can do is checking in with the mom and baby on a regular basis. Also, making meal preps for them. Especially if they have other children in the home, they not gonna, they may not want to or feel able to, prepare their meals. So meal prepping for them. Get yourself tested for COVID, okay? And, be able to be present for that woman if possible. So those are some of the things that I would recommend, at this point.
even ahead of time, preparing foods and making sure that it can be frozen so that that family could just go in and pop it out, heat it up. They don't have to cook, because you may have somebody who has had, birth can happen different ways, right? You may have a vaginal birth, you may have a cesarean birth. Either way, you're going to have to recover. And it's not easy to get up and walk around and cook and clean after you've had a baby, although you may see women actually attempting to do that. We shouldn't have to do that. So making sure that those things are taken care of. Also, maybe gift cards to different restaurants where they might be able to just order food or pick up, or giving gift cards so that they can order what they need. And a lot of times, and outside of COVID, this next suggestion, we tend to focus a lot on the baby with the baby shower, but the truth of the matter is the baby doesn't really need that much, right? Baby doesn't need so many items that we buy. Half the time the baby don't use half of the stuff, right? But having a postpartum shower where we make sure that the family is taken care of is what's really important, right? Making sure that the mother is good, she has the supplies that she needs in order to mother and parent successfully. So whether that be breast pads or nipple cream or whatever it is that she needs in order to be a good mother and parent is what we really need to be focusing on.
Okay.
Thank you. I'm gonna keep on asking questions. So when it comes to the cesarean versus the vaginal birth, which is always a discussion, especially in the African American community, and specifically because that's all we're talking about, really. What do you see as obviously a better option in the situations that a vaginal is better than a cesarean, and kind of the difference between the two? Obviously, it's big difference, but like recovery time and all that. If you can just kind of shed light on that, that'd be great.
Sister Adrienne?
Okay, yeah. So cesarean, vaginal birth is always our ultimate goal. Okay, we want women to have vaginal births because we know that women have been having babies vaginally for years, and we know it can be done. We may have to go in all kinds of positions, to kind of help a woman have a vaginal delivery, but vaginal delivery is always our ultimate goal. But if a woman has to have a C-section, whether it be an emergent C-section or if she's having a repeat C-section, it is a long recovery period, and it is major surgery. A lot of injury can happen with a cesarean section. So we really try to avoid having cesarean sections. The C-section rate is about 30%. We're working on getting that rate continually down. But unfortunately, with COVID and everything, a lot of insurances and other folks are wanting us to do more cesarean sections because that's where the money is made under surgeries. But again, our goal is not to have C-sections unless it's absolutely necessary. So,
the World Health Organization.
Go ahead.
Go ahead.
Mm-hmm. No,
I was just gonna say the World Health Organization recommends no more than 15% for cesarean section rate, and we see hospitals with 30, 33, 40%, or even higher. So it can get crazy. And a lot of times, if you're in a vulnerable situation, you haven't been educated, you don't have a support system, you don't know what your options are, you don't even understand labor. You don't realize that you can stay at home and labor at home until it's time to, go to the hospital. You may go in a little early. I mean, there's so many variables that go into childbirth, but a lot of times we go into it without the background and the education and find ourselves in situations where we're kind of stuck. We don't even know how we got there, but cesarean is now on the table as the option. The goal is to prevent that first initial cesarean section, because some medical providers still have the idea that once a cesarean, always a cesarean. And they've instilled that in their patients. And so that is even going around in communities, once a cesarean, always a cesarean. And we know that that's not true, but the goal is to try to avoid that primary cesarean if necessary. And sometimes that takes having an education, having a support, starting early, not waiting to the last minute to try to learn about birth, which is what I did. I didn't start really caring about pregnancy, breastfeeding, or any of this until I got pregnant with my own child. And from that experience and from speaking to other people, I realized that the hospital wasn't a place that I was going to have my children. But even if that is something that you choose to do, you should know what your options are. If they're talking about induction, what are your induction options? Are they using a Foley catheter? Are they using Pitocin? Are they using, Cytotec? Like, what is it that's going to be offered to me at this particular hospital? Also asking about our providers, what is their philosophy on episiotomy? If that's something that you want to avoid, which is when they cut the perineum to allow more space for the baby to come out, you may want to talk to your provider about what their philosophy is about that, right? A lot of times we choose our providers based on who our family went to. Oh, my cousin went to him, that's the local doctor. My whole family went there. And so we don't even realize that if this was a car, we would be running Kelly Blue Book, right? We would be trying to run the facts, right? Car facts, and say, okay, well, what has this car been through, and what's the experience? But we don't do that with our providers when we should, and we can. We just don't realize it.
Absolutely. Why don't we? A car, a life. All right. Just one of them things that make you go, as Arsenio would say, okay. Let me ask a question. We've been talking a lot about the doulas and what they do. But then there's also the midwife. I'm not all that familiar with the role of a midwife as well. So if somebody can just kind of school me on what a midwife is. And I see someone said, do your own research. I dig that in terms of doing your own research. I think this is part of it. The first thing we need to do is stimulate interest. Nobody randomly does research without being engaged at some point. So I agree to 100%. I'm sorry, sis. Go ahead.
No, that's okay. So where are we at? You want to know a little bit more about midwives?
Yeah.
Yeah. So midwives, there's different types of midwives. Yeah, there's midwives, certified nurse midwives, and we're educated in midwifery and nursing care. And we go through accreditation, and then there's certified midwives, and a lot of times they go through an apprenticeship. But they're able to provide midwifery care in the sense that you care for women and you provide women's health, whether it be gynecological health, pregnancy care, preconception counseling, as well as STD screening and your annuals and your PAPS, women's health, throughout the whole gamut. But our, midwifery is a lot about just birthing babies and being with women as well. Just to help empower women and also to be with them through the lifetime. So being with women and labor and delivery and low intervention is what our main focus is, and just more of a holistic care and approach to women's health.
Now, what's the schooling difference in terms of learning curve? And then I need to clarify something. For the sister who said do your own research, I think she was talking to mothers who are about to give birth. I took it out of context. I'm in learning mode, so I apologize. So what's the difference in terms of the amount of schooling or certification between a midwife and a doula? Like, tell me what, I'm not quite sure, so I'm asking.
Oh, so a doula is not a medical provider at all.
Okay.
Most doula training organizations will train you from, 3 to 5 days, and then you have a few years to complete your requirements. That might be readings and reports and attend births and things like that. The Earth's Natural Touch Birth Care and Beyond training is 14 months, and we cover everything from antenatal support, birth, postpartum, through to bereavement. But we also touch on a lot of the issues that we're dealing with in our communities, like domestic violence or womb trauma and just trauma in general, right? Just the fact that we are Black people living in America, we've experienced some trauma, and what that looks like and how that might manifest in our birthing experiences. We also talk about teen pregnancy.
Okay.
We talk about nutrition. So there's a lot to cover because there's a lot that goes into this work. But yeah, it's totally different than a midwifery program. So now I'm in an out-of-hospital midwifery program, and there are different routes that you can go even within that. But my schooling, they give you up to 7 and a third year to complete all of the requirements. And like Sister Adrienne said, there is an apprenticeship portion that goes into that. But I'm training specifically to provide support in out-of-hospital settings. So, and CNM, certified nurse midwives, can work in hospital settings or out-of-hospital settings. And Sister Adrienne can talk more about like how long it took her, how long the program was that she went through.
Okay. Yeah. So I was a registered nurse prior to going back to midwifery school. So to get my, RN degree, my bachelor's degree was the 4-year process. And then I was in the midwifery program for 2 years. There's a 1-year program and 2-year program. So I was in like 1.5 years. And so now they have it where you get your dual certificate in midwifery and your master's in midwifery as well. But I had attained my master's in nursing, so I didn't go for the master's in midwifery. So the schooling is about 2 additional years, and then you go into either a private practice or a midwifery practice here in Massachusetts. We can practice independently. We don't need a supervising physician to practice here in Massachusetts. Some other states do require that you have a supervising physician. To practice.
And we need more Black midwives, no matter what setting you're in.
I was about to get into that, and I'm going to get into that right now, because I think a large portion of what Dee really wants to do is get and educate people on the different industries within healthcare completely that we as Black people need to be represented in. And Miss Adrienne, yourself can really get into that, and doulas and Black doulas, and we need to know what we can do to help educate people on that being a new field they can kind of get into, and kind of explain how they would get into that as well.
The sad part is that it needs an explanation, because this is probably the oldest field there is, right? But the fact that we have to explain to people that this is a field is really, that goes to show you about that shift in mentality when obstetrics came into play, right? From, midwives to OBs. But I think that we just need to continue to do the work and continue to have these conversations in different spaces. So you all have a newspaper, you all have this platform, social media, whatever we can do to continue to push these conversations and try to encourage people from young. Like I said, prior to pregnancy, women need to be learning about their bodies in general. Like, how does this work? Why is this like that? So many times we hear from people that they don't want to breastfeed for interesting reasons. And a lot of times there's not a lot of social support around that, because maybe other people haven't seen breastfeeding. Maybe they haven't seen it done successfully. And so if you're not around people who are actually doing this, then you don't even realize that it's a possibility.
No clue, sorry.
Yeah, no clue. And when it's your turn, it's just like, oh no, I'm not going to do that. And it's the same thing with birth. The automatic is that you go to the hospital, you have an OB, and a lot of times midwives are like the afterthought. You don't even think about them initially until, somebody mentions it. So just continuing to have these conversations is important. And like the sister Oshun that was saying, do your research. She's constantly pushing a lot of information. Tanita, Laconia, they're out there in Springfield trying to do the work. And it really is going to take just like the groundwork. And I honestly believe that it's the relationships that you build with the people on the ground that is going to change the mentality about birth. Hearing it from up here is not really going to make the hugest impact. It's literally seeing it in action that's going to make a difference.
So we have to make this part of our regular conversations, period, across the board. Family conversations, churches, mosques, we need to be having these conversations. It's crazy because when you talk about breastfeeding, it's so taboo. When people talk about, breastfeeding, that's nasty. It's kind of like, no, that's not. And it's so natural. It's not nasty. It's natural. So there are just so many taboo things that we walked off the plantation with that, we really got to do some serious deprogramming. So, wow. I learned a lot.
Intentionally, though. That was intentional.
Oh, absolutely. Say it again.
Intentionally.
Thank you. So we really have some work to do in terms of educating our folks and really pushing. We're coming near the 1 hour mark, but I want to say really pushing this type of information our Black health is the last thing that we discuss. Forget about just childbirth, which is like, I don't think there's anything in the world more important than childbirth. Nothing in the world is more important than that. But when we look at our health, we very rarely talk about Black health. We only talk about it in terms of the disparities because we don't have those conversations and we don't make it a priority. We can talk about sports, politics, economics, but when it comes down to health, yeah, when I need a doctor, I go see a doctor. So we got to change that. So I appreciate both of y'all for being on here. Justin, I'm going to turn it back over to you because I'll start jabbing all night.
Yeah, because Adrian didn't get to say basically the kind of process of being a midwife and the disparities of actually seeing a Black midwife, which we were looking for you. And I'll be honest, and I'm real. Sorry, Adrian. Mercy was not that great. They were trash. All right. And so there was a cultural barrier. There was a huge cultural barrier when Laconia and I went in there, and then I had to play a different mode. And if you can kind of, because you came highly recommended, Miss Adrian. You came, when I mean people just be, oh, Miss Adrian, please tell them the significance of a Black doula for Black midwife for a Black person, as well as getting into that field as well.
I mean, having someone that looks like you and can relate to you helps you to feel more comfortable. I mean, I have women coming through and, you know, they just don't, not necessarily a midwife, but a Black midwife. They said we didn't know that they existed. And so just being aware of your surroundings, I think is helpful for women, and having someone that looks like you to help you feel comfortable, to go through the process of birth, to educate you, you know, about what's going to happen and what you can do to make things better is very beneficial for women. And I'm losing train of thought because it's getting past my bedtime, but sorry. And so just having a Black midwife and increasing and continuing on with these conversations, and, you know, that the education is out there. There are programs out there. And, you know, like our sister said, the midwives have been around forever. You know, they've been around for a long time. And, you know, educating our young girls now that midwifery is an option for them to help other women through this process. Mm-hmm.
All right.
And yeah, it's so I'm glad that both the legends are in the building. You know what I mean? I really call you guys legends because when we were talking about birthing at Mercy, birthing period, everybody was like, and they knew how me and Laconia were when it came to making sure we were around somebody that looked like us and understood basically Black health, which is a lot different as far as you can see the disparities as well. But it's a legend as well. You in Connecticut, but your name is renowned, and I don't like to butcher names, so that's why I keep on. So
it's literally how it's spelled. It's Psi Honor Devotion.
Psi Honor, all right.
Yes, and we have doulas in Connecticut. We have doulas in Massachusetts, Rhode Island, and several other states across the country.
You know what's crazy? I've been connected with you on Facebook for years, and I've been pronouncing your name Schooner.
You know, you're not the only one.
When you said
Shadora, Schooner.
Got it. All right. So I think that's it, unless there's something that anybody would like to add, because we don't want to keep people on all night. We like to get on and off an hour, give people as much information as we can before they start shutting down. So is there anything else either one of you would like to add?
I didn't see if there were any questions. I don't mind answering anything if there was in the chat.
I was looking. There were no questions. Just, you know, Sister Osun said, brothers do have to think about these things before it happens to someone in their families. All these Black women and babies that aren't making it have Black men in their lives. Absolutely, same thing you said. Most of them just reiterating some of the things that you guys were saying on the air. Yes, I was referring to mothers not taking recommendations. I apologize about that again. I'm in like my own learning mode. I was being selfish, trying to super part of info. But there are no questions, just sisters who are basically agreeing with everything you guys are saying.
And even though we touched on it, breastfeeding is the way to go. I know you guys already said it. Please, it's not a myth. Doctors that are not in OBGYN or women's health completely will always steer you away from it for some reason. But it's for another topic. You can go 3 hours on breastfeeding alone. So breastfeeding is not a myth, Black woman. You mean your milk holds power. Understand that. And if they want to go bat for bat for pathophysiology, you didn't mean they can call 413. they can just look it up themselves.
Tanita Council says, how could someone be a doula? I think they talked about it earlier in the show, but just real quick snapshot. How could, if my 17-year-old daughter wanted to become a doula, where would she start?
So she could always contact me. If our organization is not for her, then we'll find some organization that she best resonates with, because every doula organization has its own personality and own special features about it. So they're not all built the same. And so we're at www.earthsnaturaltouch.com. You can follow the hashtag earthsnaturaltouch, or facebook.com/earthdoulas, and on Instagram we're earthsnaturaltouch. But it's just a simple inbox, and I send them all about our program, and I also include a link to other training organizations that they can look into. I haven't vetted them all, so I can't say which ones I prefer and all of that, but at least, like Oshun said, I send the link and they can take the rest from there.
Okay. And then Miss Adrian, if someone wants to become a midwife, they would have to go to school for that, correct?
I'm sorry, I didn't hear you.
If someone wanted to become, if they were interested in becoming a midwife, that's something they would need a degree for, correct?
That is correct. And there are lots of programs available.
Okay, awesome.
Or they may want to become an out-of-hospital midwife, where they don't necessarily need a degree. And if they contact me, I can help them with that too.
Okay.
Yeah.
So everyone, if you have any questions, please contact. Watch me. Hold on, Justin. I'm gonna get this right. Please contact Sayana, and she will give you the information. I got that name right?
Yes, sir.
Go ahead, Justin.
And then if they're looking for a doula in Springfield area, they can contact Springfield Family Doulas for culturally relevant care. All right.
Yes. Big up.
SpringfieldFamilyDoulas.com. All right. And that's Springfield Family Doulas on Facebook as well.
All right. All right, people. With that being said, we always do closing thoughts. So Sayana, I'm gonna start with you. Just closing thoughts, things that people can take away with them. We will be replaying this all throughout the week to ensure that as many people as possible can hear the information that you're sharing. Mm-hmm. So please, closing thoughts.
I know right now a lot of people are afraid of birth, and I just want Black women to realize that we are surviving and thriving. We're not just dying. So, birth is not a space that you want to go into full of fear. It is a natural physiological process that we've been doing since the beginning of time, and we can continue to do it. We just need to make sure that we have the knowledge and the support in order to do so successfully.
Thank you so much. Miss Adrian, closing thoughts?
Get on mute. There it is. Okay. So I just thank you for your for having me on. Thank you for your program. And just want women to know that you are strong. You are beautiful. We are here for you, and I want you to be empowered.
That's beautiful. Justin, thank you so much, Miss Adrian. Justin, shut it down for us.
Love yourselves, Black people. That's what it starts with. That's what it ends with.
All right. Good night, everybody.
Black Health Matters.
Black Health Matters.
Black Health Matters because Black Lives Matter.
Because Black Lives Matter.
Black Health Matters because Black Lives Matter. As Martin Luther King Jr. said, of all the forms of inequality, injustice in healthcare is the most shocking,